back teeth are lost in the upper jaw, the natural bone often recedes, and the maxillary sinus cavity expands downward. This process leaves a paper, thin layer of bone that is insufficient to anchor a dental implant securely. A sinus lift procedure is the standard solution to regain this lost foundation. To understand the challenge, we must view the anatomy in cross-section. Beneath the gum tissue lies the alveolar bone, and directly above that is the maxillary sinus, lined by the delicate Schneiderian membrane. For successful implant placement, we need substantial bone height, which is currently missing in this area. The procedure begins with a precise incision along the gum ridge where the teeth are missing. This careful opening is designed to provide access to the underlying bone structure while preserving the health of the soft tissue. Using a surgical elevator, the gum tissue flap is gently reflected upwards. This exposes the lateral wall of the maxillary bone, providing a clear, clean working surface for the surgeon to access the sinus cavity safely. A small window is created in the bone using advanced piezoelectric technology. This ultrasonic tool uses vibrations to cut through hard bone with extreme precision, but it automatically stops cutting when it touches soft tissue, ensuring the delicate sinus membrane underneath remains unharmed. The isolated oval of bone is then gently pushed inward and upward into the sinus cavity. Instead of removing this bone, it acts like a trapdoor, hanging up to become the new roof of the augmented bone level. Specialized instruments are carefully inserted to elevate the Schneiderian membrane from the floor of the sinus. This delicate peeling process lifts the membrane upward, creating a protected tent-like space between the sinus lining and the jawbone. This elevation creates a significant void or pocket. While the air volume of the sinus is slightly reduced, normal sinus function remains completely unaffected, and a crucial new volume is established for bone regeneration. The newly created space is then packed with bone graft material. These biocompatible granules act as a structural scaffold, filling the void completely and maintaining the height of the lifted membrane to prevent it from collapsing back down. To protect the graft and ensure undisturbed healing, a collagen barrier membrane is placed over the lateral window. This crucial step prevents gum tissue from interfering with the bone graft, allowing only bone cells to regenerate in the cavity. The gum tissue flap is repositioned over the surgical site, and sutures are placed to seal the incision. This closes the wound completely, protecting the underlying graft and initiating the primary healing process. Over the next several months, a biological transformation called ossification occurs. New blood vessels grow into the graft, and the body's natural bone cells replace the granules, turning the scaffold into solid, dense, living bone. Once the bone has matured, the site is ready for restoration. A titanium dental implant is inserted into the newly regenerated bone. The increased vertical height ensures the implant has deep stability and anchorage, sitting safely below the new sinus floor. Finally, an abutment and ceramic crown are attached to the implant. The result is a fully functional, natural-looking tooth that restores chewing ability without compromising the sinus health. From a lack of bone to a solid, reconstructed foundation, the sinus lift surgery successfully rehabilitates the upper jaw, enabling permanent tooth replacement. Thank you for watching this visualization of sinus lift surgery.